The Therapeutics Development Network was founded by the Cystic Fibrosis Foundation in 1998. It was initially founded as a mechanism to increase participation of CF patients in clinical trials and thereby advance both our understanding of cystic fibrosis and to advance our treatments. And it's been immensely successful. Yeah, the entire Fort Worth CF Center and Cook Pulmonary program is involved in the TDN Center. With each research study that's done, one of the physicians would be designated as a local principal investigator for that research study. Sarah Scott is our research coordinator for the TDN Center. All of the physicians, however, would be sub-investigators on that, and the nurses participate as well, both in the care of the patient as well as in the administration of the research project. The Fort Worth CF Center has participated in clinical research for CF for many years. Most of those have been multi-center trials, new therapies for CF where they need a large number of patients to validate that those treatments work. And we participated in those for many years. Becoming a member of the TDN, however, puts you kind of in the middle of those research projects of always being aware of the research that's going on and always being able to participate in all the latest research that's going on. So it definitely improves the number of research projects that your patients have access to. It also takes our physicians and kind of puts them on the cutting edge of science and research advances in CF, which is something that's very important in staying stimulated and challenging us to render absolute best care we can for our patients.
I was approached by some people at the CF clinic and told that I was eligible to participate in a research project. Would I be interested? And I said sure, and both times I was asked if I would participate in one, I did. Both tests that I participated in had to do with TOBI and tobramycin in phase 1 and phase 2. And I was excited to have that opportunity to participate in a project that could ultimately affect the lives of people with cystic fibrosis in a positive way. It would have made it easier to do treatments because the existing TOBI treatment takes a long time to do, and this would have been easier, shorter, quicker, which would encourage compliance. And I'm real excited about anything that encourages people to be compliant in their treatments.
Fort Worth CF Center has grown over the years. When I first came to Fort Worth, I believe we had 35 patients, and we're up in the vicinity of about 300 patients now. As research advances have resulted in improved care, CF patients are living longer and longer lives. The median life expectancy for a CF patient in the United States is upwards of 38 years now. So adult care of CF has become a big issue, and in the last year the Fort Worth CF Center has developed a separate adult CF program as well. We have 3 adult pulmonary physicians who coordinate that care. So currently our CF Center really takes care of everything from newborns and infants up to adults with cystic fibrosis.
A doctor told me he didn't encourage me to go to college because he didn't think with CF it would be very easy and it would probably not be beneficial if I wasn't going to live late into adulthood anyway. And because he told me I shouldn't go to college, I wanted to go to college really badly. And I got my degree and I wanted to go flaunt it in front of him, but I didn't do that.
Carol's a very dynamic personality. She's very positive and she's very upbeat, and that's very important in CF care. CF is a very effort-dependent disease. Patients have to work hard to stay well, and to be upbeat and positive is a very important attribute in staying healthy.
I would highly recommend other patients get involved in research. Somebody has to do this. If we don't volunteer and help make advances in research and in medication and therapies, then they won't be made. They have to have people volunteer for the research or these advances won't take place. And it's very important, not just for you, but for everyone else that has an illness or cystic fibrosis in particular. We can develop new and better technologies with the research.
We've developed a program where our patients have done well. We've been able to recruit physicians that are known to be top-notch and experts in their field. And I think it's also a tribute to Cook Children's healthcare system that we are known out there as being a place that's very patient and family-centered and where children can get the best care available.
Well, I think all of the people I've worked with in Cook Children's Hospital have been very wonderful people. They've been kind and generous, and they're centered around individuals. They very much care about the patients. You can see it in everything they do. It's a pleasure to work with people at Cook Children's Hospital because of the kind of people that want to work here.
You know, our goal here at Cook Children's is to render the absolute best care we can to our patients and families. And we truly believe that participating in clinical research helps us to do that better. When you participate in clinical research, we have to stay abreast of all the latest changes, of the most recent scientific advances, of what potential therapeutic avenues are there. It allows us to know what studies are going on and the opportunity to participate in them. It allows us the opportunity to offer participation to our patients in those trials, which is very important to those patients and families. So overall, we feel like participating in clinical research improves our ability to care for the patients here at Cook.